Hello, everyone. We're going to go over the trees for the final exam. These are the vocabulary. This is level 2. This is for the final oral exam. So here, looking into the tree, we have itis, which is inflammation, pathy, disease, ectomy, to remove or cut out. Logist is a specialist that studies something. Megaly is enlargement. Sclerosis is hardening. Malacia is softening. Oma is tumor or mass. Pexy is fixing in position. Raphy is to suture. Ptosis is drooping. Tomy is to cut into. So here are the words: nephritis, inflammation of the kidney. Nephroma is a tumor in the kidney. Nephropathy is kidney disease. Nephrotomy is to cut into the kidney. Nephrectomy is to cut out the kidney. Nephrorrhaphy is to suture the kidney. Nephroptosis is a drooping kidney. Nephropexy is to fix the kidney, surgically fix the kidney in place. Nephromalacia is softening of the kidney. Nephrosclerosis is hardening of the kidney. Nephrologist is a specialist who studies the kidney. Nephromegaly is enlargement of the kidney. Here's the next set of terms. Inside the tree, we have ectomy, which is to cut out or remove. Rhagia is excessive bleeding. Itis, inflammation. Scopy, to look into. Algia is pain. Tomy is to cut into. Plasty is to repair or restructure. Cyst here means urinary bladder. Cystoscopy is to visually examine the urinary bladder. Cystectomy is the removal of the urinary bladder. Cystotomy is to cut into the urinary bladder. Cystalgia is pain in the urinary bladder. Cystitis is inflammation of the urinary bladder. Cystorrhagia is excessive bleeding from the urinary bladder. Cystoplasty is to surgically restructure or repair the urinary bladder. The next set of words have to do with coli. Coli means bile. Cholecystos or cholecystos means gallbladder because it produces bile. Cyst is the bladder, is a bladder, and chole is bile. So cholecyst is basically the gallbladder. Lithos is stone. Docus is duct. In, anything that ends with an in is a protein. Kine means movement. Kine, kinetic. Kine means movement. Trypsy is to crush. Tomy is to cut into. Itis is inflammation. Ectomy is to cut out or remove. Asis is a condition or a situation. Cholecystitis is the inflammation of the gallbladder. Choledocholithiasis is a state in which the bile duct, choledoco, meaning bile duct, has stones in it, has gallstones. Choledocholithotripsy means to crush the stones inside the bile duct. Cholecystokinin is basically a protein hormone that moves the bile out of the gallbladder. So cholecystokinin is a hormone that acts on the gallbladder. Cholecystectomy is the removal of the gallbladder. Choledocholithotomy means to cut into the bile duct. Choledocos literally means bile duct. So we'll go to the next one is cardia. Cardia, as we know, is heart. Dynia means pain. Megaly, enlargement. Tomi, to cut into. Ium is a lining. Endo, inside. Epi, upon or outside. Myos is muscle. Brady is slow. Peri is around. Tachy is fast. Raphi is to suture. Pathy is disease. Dynia, as we said, was pain. Tachycardia means fast heartbeat. Bradycardia is a slow heartbeat, slow heart rate. Endocardium is the inner lining of the heart. Cardiodynia means pain in the heart. Cardiomyopathy means disease of the heart muscle. Cardiomegaly means enlargement of the heart. Cardiotomy is to cut into the heart. Cardiorrhaphy is to suture the heart. Epicardium is the lining upon or outside the heart. Pericardium is also a lining outside the heart. Endocarditis is the inflammation of the inner lining of the heart. Myocarditis is the inflammation of the muscular lining of the heart. Here we have the next set, ophthalmos. Ophthalmos means eye. Ragia, excessive bleeding. Plegia means paralysis. Endo is inside. Scope is instrument used to visually examine something. Xeros is dry. Itis is inflammation. Algia, pain. Logist, specialist. We have ophthalmorrhagia, means excessive bleeding from the eye. Ophthalmoplegia means paralysis of the eye. Xerophthalmia means dry eye. Ophthalmoscope is an instrument used to examine the eye. Ophthalmalgia means eye pain. Ophthalmologist is a specialist who studies the eye. You can't see the one at the bottom, I'm sorry. So here we go. We have otos. Larynx is voice box. Mycosis, fungal infection. Rhea is flow. Pyos is pus. Itis, inflammation. Media, middle. Algia, pain. Sclerosis, hardening. Lith, stone. Scopy, examine or to look. Logist, specialist who studies something. Logi, the study of something. Otomycosis is fungal infection in the ear. Otology, study of the ear. Otologist is a specialist who studies the ear. Otosclerosis is hardening of the ear. It's usually a bone in the ear. Otopyuria is the flow of pus from the ear. Otolith is the stones or crystals inside the ear. Otoscopy is the process of examining the ear. Otitis media is inflammation of the middle ear. Otalgia, pain in the ear. Otolaryngologist is a specialist who studies the ear and the larynx. Next list is epi. Epi is upon or outside, or wrapping something is usually epi. So epineuron is nerve. Glottis is the opening into the voice box. Dermis, or the windpipe, it leads to the windpipe. Dermis is skin, myos is muscle. Epineurium, eum means lining, so epineurium is the outer lining of the nerve. Epiglottis is a lid that closes off the opening into the windpipe. Epidermis is the upper layer of the skin or outer layer of the skin. Epimysium is the outer covering of a muscle. Epineurium, outer covering of a nerve. Epimysium, outer covering of a muscle. Epidermis, outer covering of the skin. Epiglottis is a lid that closes off the opening of the windpipe. Dis, we all know what dis means. Dis means difficult or painful. Rhea means flow. Menos means monthly. Ia is a condition. Lexis is word. Pnea or pnea is breathing. Dyspnea means difficult breathing. Dyslexia means difficulty reading words. Dysmenorrhea is difficult or painful monthly flow or painful menstruation. That's it. I'm going to stop here. Here we go.